We're going to start our webinar tonight. The Professor Wang, his video, there's some problem, but he can share with the PPT. So we're still going on our webinar tonight. So, dear doctors and colleagues, Happy New Year and good evening. Today, we are truly honored to welcome Professor Ying Wang, the founder of Modern Abdominal Diagnosis Acupuncture, for an exclusive introduction to a clinical system that has transformed outcomes for practitioners worldwide. Today, there's a lot of new friends joining us, so let me introduce myself. I'm Dr. Grace, founder of Pusat Rawatan Traditional Yongho and Yongho TCM Center. I graduated from Shanghai University of Traditional Chinese Medicine and have spent the past 19 years in full-time clinical practice, helping patients with complex, chronic, and recurrent conditions through precise traditional Chinese medicine diagnosis and treatment, including herbal medicine and acupuncture. I firmly believe that true clinical excellence comes from two things: learning from an authentic lineage mentor and mastering a system that delivers consistent real-world results. To help more practitioners move beyond trial and error treatment and achieve clear, reproducible outcomes, I established Yongho TCM Center in 2015. The center focuses on advanced, results-driven TCM training that translates directly into clinical improvement. Our programs integrate proven systems such as modern abdominal diagnosis, Use-Cup acupuncture, balance method, modern tongue diagnosis, Tian-Shen ophthalmic acupuncture, and gynecology and infertility treatment, alongside structured online education. I'm honored to be a direct disciple of Professor Ying Wang, and I bring this lineage-based clinical knowledge into every course we teach. My mission is simple: to help TCM practitioners diagnose with confidence, treat with clarity, and achieve results that last, while advancing the global recognition of traditional Chinese medicine. Well, now let me introduce Professor Wang. Professor Ying Wang graduated from the Department of Acupuncture at Shandong University of Traditional Chinese Medicine in 1992. He currently serves as Vice President of the British Acupuncture Practitioners Association and is an active lecturer at the British Academy of Chinese Medicine. He is also a recognized expert at the Swiss University of Chinese Medicine and the French Association of Traditional Chinese Medicine, and serves as Executive Vice President of the Overseas Alumni Association of Shandong University of Traditional Chinese Medicine. In addition, Professor Wang is a specially appointed senior clinical expert at Beijing University of Chinese Medicine and a specially appointed supervising instructor at Guangdong Provincial Hospital of Chinese Medicine, reflecting his high level of clinical authority and recognition. Professor Ying Wang emphasizes the integration of classic theories with modern anatomy, forming a unique and practical approach to diagnosis and treatment. By combining acupuncture with Chinese herbal medicine, he focuses on providing systematic and targeted treatments for patients. His clinical methods utilize comprehensive and detailed approaches, enabling accurate diagnosis and improving the efficacy and standards of treatments. The modern abdominal diagnosis and acupuncture treatment system was developed by Professor Ying Wang. This method integrates traditional abdominal diagnosis with modern treatment principles, combined with the professor's own clinical experience and the research and development efforts of the DREAM team. The technique is used to treat functional disorder or internal conditions and aims to enhance the body's self-healing capacity, targeting root causes of diseases. This method is highly suitable for clinical application, improving treatment efficacy and addressing unresolved conditions. It can also enable us to treat various complex and difficult cases. So guys, please get ready with your notes, and also please turn off both video and audio to avoid disrupting the lecture. If you do have any question during Professor Wang lecture, please write it down, and we will have question and answer section later. So let's welcome Professor Wang.
Okay. Hello, everyone. I'm glad today we have a chance to share modern abdominal diagnosis acupuncture to you. I'm sorry today because my video, I don't know what's happened. My computer doesn't work properly, but we still can share the PPT. So you can see the PPT. Just you can't see my face. So today, the topic is modern abdominal diagnosis acupuncture. In China, we have a saying, if the abdomen is soft like a cotton, all diseases will stay away. Okay, you see. This is a healthy person always has a very soft and supple abdomen. A person who shows abnormalities upon abdominal examination must have underlying health issues or is in a sub-healthy state. The abdomen is like a mirror that reflects various problems within our body. Therefore, in clinical practice, we can use the method of traditional Chinese medicine abdominal diagnosis to guide the treatment. So we should remember this thing. If the abdomen is soft like a cotton, all diseases will stay away. Okay. So this PPT, what is abdominal diagnosis? Abdominal diagnosis, palpation is one of the 4 diagnostic methods in TCM. It can diagnose diseases by palpating the corresponding areas of the abdomen. Modern abdominal examination also includes palpation of thoracic area. Now, what is abdominal diagnosis acupuncture? We call it ADA. Okay, ADA is a clinical diagnostic treatment method formulated around positive signs found by palpation of the abdomen. It means we use the positive signs we found to guide us to do the acupuncture. Let's see the origin and development of abdominal diagnosis. Abdominal diagnosis originated in China during the Qing and Han dynasties. There are discussions about abdominal diagnosis in works such as Yellow Emperor's Classic of Internal Medicine, 黄帝内经, and the Difficulty Classic, 难经, and Treatise of Febrile Diseases, 伤寒论. Modern ADA is derived from the Difficulty Classic combined with other abdominal diagnosis methods and modern anatomical knowledge, utilizing a variety of acupuncture techniques. In clinical practice, palpation examination of abdomen is the primary diagnostic tool. This holistic approach aims to eliminate the positive abdominal signs. We call it the internal symptoms or internal signs. This is the root cause the diseases. And symptomatic treatment is supplementary to this. So it means the symptomatic treatment is we should follow the abdominal science treatment. The abdominal sign treatment is the first treatment. The symptomatic treatment is the second treatment. Modern ADA is an innovative and open acupuncture diagnostic treatment technique, resolving problems of diagnosis, treatment, and verification in clinical acupuncture. So let's see the main contents of abdominal examination. We should know the abdominal examination. It includes TCM abdominal examination and modern abdominal examination. What we learned in the uni or in the school for the abdominal examination is about modern, the West medicine abdominal examination. It's not the TCM abdominal examination. Okay. Now we will introduce to you today is what we should examine for the TCM ones. So the TCM abdominal examination also includes the first one is holographic principle applies the positioning of five zone in the abdomen, mainly seen in the 1916. Its difficulty, the 16th issues. Whether abdominal areas reflect diseases in the corresponding zone organs. The second, examination of 12 move points. Third, examination of other important acupoints and meridians reflex area. Okay, let's see this chart. In the 1916 difficulty, the holographic positioning of five internal organs in the abdomen is described as follows. We can see the picture. The liver is on the left side of the navel. Yeah, it's the liver. The lungs are the right side of the navel, the white circle area. Okay, the spleen is in the central of the navel, in the central yellow circle. The kidneys are below the navel, the black circle area, and the heart is above the navel. Yeah, the red color. Okay. So let's see the work of the 1916 issue. Okay. Because in the beginning, we said the TCM abdominal examination is based on the Nanjing, difficult classic Nanjing, the 16th. Let's see the 1916th. It said the Yellow Emperor asked Qibo. It said the pulses can be examined by 3 sessions and NAR levels, as well as yin-yang nature. Further examine it by light or heavy pressure, or by using the concept of 60 informants. But now people, they don't know what is the 60 informants. They all disappeared, lost. All the concept of the single pulse changing with the 4 seasons. So different seasons have different pulse. The distance from the sages is long as far and far. Everyone selects one of these methods and considers his or her choice to be the correct. How can one distinguish what's correct or incorrect? This is a yellow emperor to ask Qi the famous doctor. There are so many different poses methods, and the people in that days, they everyone they believe their choice is best. So he asked the Qi how to distinguish it. The Qi answered, "It is like this. Any disease, any disease should be based on the presence of internal and external evidence. What evidence does disease create or present?" The emperor asked again. The Qi answered, "It is like this. Consider pathological liver poses. External evidence includes tendency towards convulsion, tremor, a green pallor, and tendency to anger." He said, the external evidence it means when people came in, you can see the people and know what's happened. Okay, what's the problem the people have? They said intensity towards convulsion and tremor. If you see people, they got convulsion and tremor, oh, this linked liver problem, and their face looks green and easy to anger. And then the follow the internal evidence is moving qi to the left of the navel, which on palpation is firm and painful. It means in the left side of the navel, if you do the palpation, you will find abdominal aorta is, very, you can feel, the abdominal aorta is pulsing, dong, 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 and you will feel it's firm and we got pressure pain. Then they followed. The disease is characterized by swelling to 4 limbs, urinary retention, difficulty urination, defecation, and cramping. If these signs and symptoms are present, the liver is affected. If these signs is not present, the liver is not affected. So in these words, and they tell us, the what is the external evidence and the internal evidence of the liver. Okay, and the internal evidence is more important. The findings for the liver problem. Okay. Now let's talk about the lungs. Okay. This consider pathological lung pulses. The external evidence includes overt facial appearance, frequent sneezing, grief, lack of joy, and an inclination to cry. So it means the people came in, you can see their face is white. Okay, they're sneezing, and it's sad and cry. So this means the people they have the lung problem. Okay, the internal evidence is moving qi right of the navel, which on palpation is firm and painful. So when we check the right side of the navel, we will find abdominal aorta is pulsing And if you do palpation, you found it very firm, and they got the pressure pain. Okay, and then they talk the other symptoms. Okay, the diseases. The disease is characterized by wheezing and coughing, shivering, feeling chills, and high heat. If these signs and symptoms are present, the lung is affected. If these signs are not present, the lung is not affected. Okay. And then they said the spleen pulses. Consider pathological spleen pulses. The external evidence includes a yellow facial appearance, frequent belching, frequency to ponder, and fondness of tasty food. Okay. Let's say the internal evidence is moving qi at the navel, which on the palpation is firm and painful. This means we can find the abdominal aorta, pulsing in the central of the navel. Okay, and it's firm and have the pressure pain. The disease is characterized by swollen and full abdomen, undigested food, body feels heavy and aching joint, feeling tired and weary, desires to lie down, and full limbs feeling generally weak. If these signs and symptoms are present, the spleen is affected. If these signs are not present, the spleen is not affected. So you talk about spleen. And then you talk about the heart pulses. Consider pathological heart pulses. The external evidence includes a red facial appearance, a dry mouth, and tendency to laugh. The internal evidence is the presence of moving qi above the navel, which on palpation is firm and painful. It means oh, you will find the abdominal aorta pulsing above the navel. If you do the palpation, you will feel the aorta is very, very hard or firm, and they got pressure pain. So this disease is characterized by uneasiness of the heart and of the pain in the heart. The central of the palms is hot and dry, and got dry vomiting occurs. If these signs and symptoms are present, the heart is affected. If these signs are not present, the heart is not affected. Okay. And the last one is kidney. The considered pathological kidney pulses. The external evidence include a black facial appearance and easily tearful, as well as frequent yawn. The internal evidence is presence of the moving qi below the navel, which on palpation is firm and painful. So we will find the abdominal aorta pulsing, below the navel. When you do the palpation, you will find that the aorta is very, very harder and painful. This disease is characterized by rebellious qi, acute pain in the lower abdomen, and diarrhea associated with heavy downward sensations, as well as a feeling of cold and reversed moving qi in the feet. If these signs and symptoms are present, the kidney is affected. If these signs are not present, the kidney is not affected. So they talk about the five zones location in the abdomen. But in the 1916th, they only tell us, uh, they not tell us accurate the positioning. So we use the new new sorry, we use the new positioning. Follow the the Kiku's book. They said the lung reflex area. They said located on the right side of the navel, along the outer ridge of the stomach meridian, around stomach 26 and stomach 27 point area. So we see the blue area, it's around about stomach 26, stomach 27, as Weiling and Daju area. The liver reflex area located on the left side of the navel, extending from the kidney meridians at Zhongzhou point, kidney 15, to the stomach meridians at stomach 26, 27, Weiling Daju area. We can see the green area, the forming a liver-shaped triangle, a liver area, you know. And then the spleen reflex area, okay, they located in the center of the navel between the CV Ren 9, Ren 9 and Ren 7 in jaw below the navel, okay, bordered by the Huangshu kidney 16 on either side. So we know the spleen reflex area, not just in the center of the navel, they include the ridge of the navel as well. So this area, okay. The heart reflex area, okay, located below the xiphoid process in the 鸠尾 and 巨缺 point is the ring CV15 and CV14, this red circle area. Okay. The kidney reflex area located below the navel to the Guanyuan point. Guanyuan is CV4 in the Dantian area. It's black area. So now when we check the valve zone, we just go this area to check, to find which zone have the problem. It's more clear than the old book. The second we need to check up is the 12 mu points. When we learn the acupuncture, we all learn the mu points because the mu point is organ's essential qi. They build up in the chest and the abdomen. Okay, let's see. The first one is the long one. This lungs mu point is 中府 point. Okay, and then ring 17, 膻中穴, this pericardium mu point, 心包经的 pericardium mu point. And then we can see ring 14, ring 14, this 巨缺 point, this mu point of the heart. And then we can see liver 14, 气门穴 is the liver's mu point. And then you see ring 12, is stomach 中脘穴, 中脘 point is stomach mu point. And then GB 24 is the gallbladder mu point. Okay, and liver 13, 肛门穴 is the spleen's mu point. And then you can see gallbladder 25. This is the kidneys mu point, 经门穴. And then stomach 25 is 天枢 point, is the large intestine's mu point. And then Shimen Point, Ring 5 is Sanjiao's Mu Point, and then Guanmen Point is Ring 4, it's small intestine Mu Point, and then last one is Zhongji Point, then 3 is bladder Mu Point. So when we check the 12 Mu points, if this point is painful and tender, so this means it's corresponding zone and Fu has the problem. So 12 Mu points can help us to do the diagnosis. Another, we should know the modern anatomy, okay? Because if only we know everything, we can do the correct diagnosis, okay? Now, this is the abdominal diagnosis chart. We give people 26 area. So we use this chart to guide us to do the palpation, okay, diagnose. Okay. Let's see this PPT. Why could we use abdominal diagnosis to guide us in the clinic practice? The abdomen is considered the second brain of the human body. This refers to the nervous system in the tissues of esophagus, stomach, small intestine, and colon, composes of neurons, nerve sensors, and scattered proteins. Similarly to the brain in the head, they can also quickly transmit information to each other, independently perceiving and receiving signals, making relevant responses, providing sensations of pleasantness and discomfort. However, unlike the actual brain, the abdomen does not possess thinking functions. So the abdomen can't do the thinking things. Evolutionary development biologists discovered division of the nerve system into two parts: the cerebral central nervous system, and the gastrointestinal nervous system. So they got two parts. Okay. The clinical studies have research which indicates that the abdomen has memory function. Abdominal signs can not only reflect current diseases, but also reflects previous disease patterns and still can indicate upcoming diseases. So we should remember this. So the abdominal signs can reflect current diseases, previous diseases, and upcoming diseases. Another theory is gut-brain axis theory. People now, they always talk about this theory. To use this theory to do the treatment, have found some of the new medicine. According to this theory, when the gut microbiota becomes imbalanced, the harmful bacteria may enter the brain through the gut-brain axis and lead to the various brain disorders such as depression, Alzheimer's diseases, Parkinson's, autism, etc. So many the brain diseases is caused by the the abdominal problem. Okay. From the perspective of modern medicine, Abdominal acupuncture can be understood as improving the abdominal environment in which abnormal gut uh, microbiota reside, allowing the disordered microbiota to return to normal. Through the gut-brain axis, this indirectly achieves the goal of treating the brain disorders. So we didn't use needles to kill the bad bacteria immediately. We use needles to help the body. We change the abdominal environment to let the bad bacteria no no chance to survive. Okay, so and they can treat the brain diseases. Okay, so let's continue to see the diagnostic and treatment principles of ADA. According to the theory of Nanjing, if 5 zang are diseased, the 6th fu will be congested. Therefore, we follow the following in clinical practice. We check the abdominal signs first, and then know what is abnormal, and we treatment based on positive signs. Okay, so this is our principle for the diagnosis and treatment. We check abdominal signs. We know what is abnormal, and then we do the treatment following the positive signs. Now, how to perform ADA? First, perform abdominal examination to find positive abdominal signs. Second, acupuncture at distal end to reduce or resolve the positive abdominal signs. Third, finally, treat the remaining problems symptomatically. Uh, symptomatically. Now, let's see the scope of application of modern ADA. ADA can be used widely in clinical diagnosis and treatment plans in various TCM pathological diseases. ADA offers good diagnostic and treatment results, especially for various complicated and chronic diseases. Let's see characteristics of modern ADA. First is clear positioning and location, so it's easy to learn. Okay, and we still use some of the modern medical terms. It's simple and easy to learn. Third, diagnosis mainly resolves around the abdominal diagnostic presentation from per patient. Okay, so the diagnosis is very simple. Okay, what we found, the positive signs during the palpation, and we use it for the diagnosis. We don't need to do the traditional Chinese diagnosis, Chinese medicine diagnosis. So it's more easy to learn. The fourth, supplementary, supplemented by cervical and thoracic spine diagnosis. So after abdominal checkup, we still check the thoracic and spine area to use this to help us do the treatment as well. The fifth, after diagnosis, treatment is primarily formulated on resolve positive signs present on the abdomen, supplemented by treatment or are symptomatic. 6. Integrated diagnosis and treatment with corresponding abdominal acupoints. So every signs in the abdomen, we have one or group point to follow it. So after we found which reflex area have the problem, we know what point we use to reduce this positive sign. So you don't need to do traditional definitions and then make a decision which point you should choose. So in our treatment, all the points we already gave to you. So it's easy to use it to the treatment. 7. Abdominal polarization does not only reflect current diseases but also previous diseases patterns, as well as upcoming diseases. Treatment of previous diseases patterns is more effective than current symptomatic fixes. It means we should, treat the previous diseases as well. 8. Pay close attention to acupoints, location, and precise treatment plan. It's very important to choose the correct points, to find the correct points, and not only follow the location of the book. So during the lessons, we will teach everyone how to find the right point. Okay. 9. Needling is light and shallow to the patient's tolerance. It does not require strong needle sensations. So we don't need, very strong needle sensation to the patient. If you choose the correct points, when you put the needles in, it works immediately. Okay. Okay. Now, to treating previous medical history is advanced than current diseases. Why? Okay. Now we see. Currently many refer to abdomen as the second human beings. The ventral brain, we call the ventral brain. In fact, the abdomen, like the brain, is also stored memory. Many previous medical texts can have abdominal signs in the abdomen. These abdominal signs often are the cause of the current symptoms or compounding factors that affect the recovery of the current symptoms. Therefore, treating the previous medical history presentations first can assist in the treatment of the current diseases. So we should remember, probably everyone in your clinic, you should find, for example, if you treat the neck problem, neck pain, and neck shoulder pain, maybe 9 people, you treat them very easily. But only 1 people you treat many times. And these people, before came to see you, they already treat through many doctors. But the symptoms always come and goes, never be totally cured. Why? I think it's not your treatment is not correct. The thing is you didn't treat the previous problem because the previous problem they always left a lot of abdominal signs, positive abdominal signs in the abdomen. These signs they affect they like the enemy behind you, they affect our body to kill the current problem. If you before to treat the current problem, you clear the abdominal signs of the previous diseases. Now you will find it's more easy to totally kill the problem. So during our treatment, we should focus on people's previous problem as well, not only treat the current problem, because our body is whole body. So every part of our body, they affect each other. Okay. Let's see a example. Case study 1, lower back pain with the type 1 diabetes. 20 years old male patient suffering from fatigue and lower back pain for many years. Came to my clinic on 21st of April 2018. The patient had low back pain and difficulty in walking, requires the use of the crutches, accompanied by epigastric pain, constipation, and anxiety. There was a history of type 1 diabetes and long-term insulin therapy. Let's see the abdominal diagnosis. The tension and pain on palpation to the REN 12 中脘 points. CV9, REN 9 水分 points, and stomach 22 关门 points, and adrenal gland area, and REN 6 气海 points, and REN 4 关元 points. The left inguinal ligament and was tender, and gallbladder 26 带脉 was tense and tender. The back examination at level 4 and the lumbar 4 level, there was tenderness from the left paravertebral to the highest point of the iliac ridge, and muscles around bilateral blood 20 皮书 and blood 21 胃书 were tense and tender. This is what we found the positive signs. Okay, after we do the examination. So we see the treatment principle. According to the patient signs and symptoms, the medical history, first we consult diabetic treatment. Okay. Because after we do the abdominal examination, we found so many positive signs is belong to diabetic, not the back pain sign. So we do the test. Therefore, we first do a acupuncture test. So we massage some point to treat the diabetic. A main point of diabetic is spleen 3 太白. Spleen 3 is main point to treat the diabetic. Okay, because diabetic is belong to Chinese spleen organs problem. Okay, so we massage it for diagnostic treatment. After 10 minutes, not 10 minutes, 10 times of the massage to the point, the positive signs of the REN 12 中脘 points and REN 9 水分 points and REN and stomach 22 关门 points and adrenal glands and REN 6 气海 points and REN 4 关 points was significantly reduced. So after we just massage spleen 3 for 10 times, not 10 minutes. This you know, there's something wrong here. Okay, 10 times. So many, abdominal positive signs reduced. So it confirmed my suspicions that the patient's lower back pain was related to diabetes. The patient was then positioned supine and treatment began. So the first step, we choose the bilateral spleen 3, kidney 6, and kidney 27. After needling, pain on the palpation and REN 12, REN 9, stomach 22, adrenal gland, and REN 6, REN 4 completely resolved. So all the positive pain in this area is totally reduced. We should remember if we do the massage the point, if we can reduce 30% the pain, but and after we needled and the points, at least we can reduce 60 or 70 of the pain. For this patient, after we needling the spleen 3, kidney 6, and kidney 27, this pain all disappeared. Okay. The patient noticed bowel sounds and whole abdomen felt relaxed, but there was still tension when pressing. Step 2. Aiming at remaining abdominal signs, we choose the kidney 7, spleen 9, stomach 13, immune point to further reduce the tension and pain in the abdomen, as well as the pain to the left gallbladder 26 and inguinal ligaments. Needle retention of the 20 minutes. Okay. And after that, we reposition the patient prone facing. We change to the position, prone position, finding that the lower back pain had completely resolved. However, blood 20 and blood 21 was still tense and tender. So this tender and it's not people's back pain's problem. This belong to diabetic pain, diabetic, blood 20 and blood 21. With step 3, we choose the do 2 Yaoshu point to reduce the pain at blood 20 and blood 21. Finally, needles the point directly, needle the rotation for the 20 minutes. Treatment is completed. Completed. The patient feels relaxed and has no discomfort, departing very happily. These people totally did 6 treatment and no problem at all. Okay. So we continue see the characteristics of the modern ADA. The 10th, the uniqueness of ADA, we have the metal water treatment method, and we still have the heating cooling techniques. It's a simple 烧山火透天凉 method. Okay, it combined with the utilization of the inhalation and exhalation. Abdominal resolving technique improves effectiveness of provided in clinical treatment. 11th, emphasizing the Trinity principle of doctor-patient interaction, diagnosis, treatment, and evaluation. 12th, modern ADA is open and inclusive. So everyone can add your technique before you learned to this system and to get the best result. Let's see this example. We use the simple heating and cooling method, and we still use the metal and water point treatment. Okay. So this case, over 1 month period of the patient has experienced burning pain in the shoulder and elbow area along the long meridians. So we choose the long meridians metal water points provided, and then we did long 5. We use this point, we did the cooling needle technique. About 1 minute later, the patient reported a cooling sensation to the right upper limb. Upon re-examination, the tenderness and burning sensation to the shoulder and elbow had completely resolved. So let's see advantages of ADA. Abdominal diagnosis is like an amplified pulsing diagnosis. Abdominal diagnosis can very accurately assist the practitioners develop comprehensive diagnosis of human body, which guide us regard treatment plans. So let's see more case studies. This one is side effects from COVID-19 vacation injection. A 56-year-old female attended the clinic with weakness, swelling, pain, and numbness to her right lower limb following the COVID-19 vacation injection AZ type 6 months ago. The patient was previously in good health. After vacation injection in March 2021, he started experiencing walking difficulties and was unable to hold the pain. Biomedical doctors suspected Guillain-Barré syndrome. Therefore, she didn't receive the second dose injection. A neurologist appointment has been made and has not yet been attended. No special treatment provided thus far. Presenting to the clinic for acupuncture treatment and was referred here by a friend. And this patient at last did the correct diagnosis. His illness is Guillain-Barré syndrome. So we can the physical examination, bilateral tension, mild to the neck, bilateral LCM tenderness, bilateral kidney 23, 27, 25, and CV REN 19 have the tenderness. Range of the movement, straight the leg, range of the movement, straight leg test. Okay, and the right lower limb 15 degree reduced, and left lower limb ROM was normal. So the right leg can't raise high, only 15 degree. Okay, and then we did the abdominal examination. REN 15 Dewey point and REN 12 Zhongwan points was tenderness. Bilateral inguinal ligament is tenderness. You see the picture of that. So the treatment plan was for the abdominal presentations. Because this is a new patient to me, before this case, I didn't treat any people who after COVID-19 vacation injection had the side effects. This is the first patient. But I didn't refuse to treat this patient, even if it's new to me, because we can use the abdominal diagnosis to guide us to do the treatment. So follow the abdominal positive signs. We did the treatment. Step 1, needle along the stomach chi lines on both sides. Needle kidney 7, spleen 9, and stomach 13, and sanjiao 9, gallbladder 14. After 30 minutes, the patient reported improved sensations in her right toes. Upon the retesting ROM, she drains almost back to the normal, much to her surprise. Step 2, patient positioned prone for further symptomatic treatment. Muscular skeletal needle technique. We use the P needle, breaking adhesions and releasing high tension points in the neck, and occipital releasing occipital region. After 15 minutes, treatment was completed. Result: right lower limb felt stronger, feet numbness significantly reduced, and was able to walk without staggering. The patient was also able to write her name, which she could not do before treatment. She left the clinic feeling happy and thankful. Let's see the small video. This is before the treatment. Let's see. Please raise your leg. Your left leg. Raise your leg. That's good. Okay. Now right. So you can't. Yeah. Oh, okay. We can see her right leg can't raise hardly. Only maybe 10 to 15 degree. Okay, this is after the first treatment. Yeah, please raise your right leg. My right leg. Yeah. That's good. Nearly normal. One more. Do you still feel numb? Feels numb. It's my little toe. Yes. Just for my little toe. How do you feel now? These ones feel good. Feel good. Yeah. Just my little toe. Still a little bit numb, but that's nothing compared to what it was. So we can see after the first treatment, we didn't treat her leg. All we do is help her to clear the abdominal positive signs. But after that, her symptoms significantly improved. Okay. Now another case. A 50 years old male main complaint the left side chest pain. So if people come in your clinic, if they tell you they got a left chest pain, in the beginning we should think about if the patient have the heart problem or not. So we need to do the examination. So we did the physical examination. The pain is on the lung 1 and lung 2. It's not angina. So, and then no changes to the pain after massaging lung 5. Later is reduced ROM, especially on the left side. And then we check in diamet area, obviously tenderness to the gallbladder 26 area. Okay. So it's a physical checkup. So when the people came in, he told me he got left chest pain. So I did chest examination. We found the pain not in heart area, but in the lung 1 and lung 2 area. So we should think about if people have the lung problem, but people no cough, no other lung problem, and then we use the lung 5 to do the test, diagnostic test. If people have the lung problem, if we do the massaging lung 5, this area's pain should be reduced some, but it didn't. And then if it's not heart, not the lung problem, this should be the muscle problem. Okay, so we let people to raise and literal raise his left arm. This you can see the ROM is reduced. So we checked, left side the same area, this very tenderness. Okay, and the people then to tell me, and she twisted his lower back before, okay, 3 months before. Okay, so there's a diagnosis. The high suspicion of unresolved sprain back issues affecting his chest. Because our body is the whole body. If people and twist their back, the muscle gradually affected the muscle in the shoulder and the chest. Then patient disclosed 3 months ago he sprained his back whilst picking something up. GP visits times prescribe painkillers which didn't work. So we do the treatment, adhesion breaking technique to the left gallbladder 26 chest pain result. Okay, result literal raise arm normal. And the people is very pleased and sad. And today he came to my clinic. His right decision. See, no, before treatment, after treatment, left side. Okay. Another study, see, this shoulder pain for 2 years was in bed when resting. You see this lady. The right arm can't raise literally. Okay, but we didn't put one needle in her arm. We just did abdominal checkup. We found, kidney area, arm pain here, and left side, right side, trunk have the problem, and right inguinal ligament area have the problem. So follow the abdominal positive signs. We did acupuncture. Okay. So after acupuncture, you see, just one treatment, ROM much better. Okay, we didn't put one needle in her arm. Okay. And this study, this lady and a female is right hand without sweating for many years. Yeah, right side no sweating. You can see the color is white. Okay. So for this problem, we still use the abdominal diagnosis acupuncture treatment. So after treatment, the hand, both hand, is sweating. Okay. This case, the chest tightness, chest pain, and palpitation after COVID-19. So after this female patient turned negative after being positive from COVID-19, one night suddenly developed chest tightness, severe chest pain, and palpitations. She attended hospital for emergency assessment and treatment. New abnormalities detected on ECG and blood test. No special treatment was given. Attended my clinic for acupuncture treatment. So the patient was experiencing chest tightness and discomfort, palpitations, anxieties, epigastric discomfort, and lower back pain. At the time of assessment, you can see this is all the abdominal positive signs we found. Okay. So according to these positive signs, we did the treatment. The first needle, bilateral stomach Qi line, left kidney 7, spleen 9, and stomach 13, and both side, and Sanjo 9, and gallbladder 40. The second step, continue the treatment of the spleen and pericardium meridian treatment. We choose the spleen 6 3阴交 and spleen 9 1灵泉 and PC pericardium and 4 Ximen point. We use these 3 points. After acupuncture, the patient's abdominal symptoms significantly relieved and breathing eased. Chest tightness, palpitations resolved. The third step, the patient positioned prone and symptomatic treatment was applied for the lower back pain. After the treatment, the patient feels completely comfortable and left happily. The patient no longer had symptoms of chest tightness and palpitations. Furthermore, after 6 treatment, pain, tenderness in the reflex area around the heart fully resolved. Okay, let's see case study 8. So you see what we found, the pain area, So the main complaint, neck and back pain, headache, dizziness, and numbness in his right hand for 4 weeks due to a rear end car collision. Treatment process. According to the patient's abdominal symptoms, treatment is also performed according to the Ren meridians, okay, of the 8 extraordinary meridians, needles, bilateral lung 7, okay, and kidney 8, 交信 point, okay. It uses 3 needles, okay. Rechecking and the affected area again, the pain almost completely resolved, much to the patient's surprise. So after we did these few needles, all the pain disappeared, and all the abdominal positive signs, disappeared as well. So this is insomnia. Patient male, 83 years old, post radiotherapy for laryngeal, the vocal cord tumor, tension throughout the whole body, abdominal pain, and restless legs, resulting in 6 days of insomnia, and presented to my clinic on 24th of August 2019. He has a history of hypertension, bilateral hip replacement, and has experienced a small stroke. Okay. So the physical examination, the muscles are slightly tense around the larynx, but there no pain on palpation. The left HCM muscle was tense and slightly tender. And then we did the abdominal diagnosis. Pain on the palpation is on the ring 15, ring 12, and stomach 26, 27, and its right side is lung area, and liver area, and bilateral inguinal ligament area. Okay, it's pain, and the whole abdominal muscles were tense. So we follow the positive signs. Okay, we do the treatment. We reduce abdominal signs, treat internal symptoms. Okay, calm and the mind. So the first step, we choose the level 4, lung 5, immune points, stomach line, qi line, stomach 13, and pericardium 4. After putting needles in, and we rechecking abdominal size, tenderness significantly reduced, and the abdominal muscles have softened. Then shallow insertion of and in-tongue points, MHN3 in-tongue points, cooling needle technique applied. So this technique makes people calm. Okay, turn off the light and have the patient rest with his eyes closed. Patient observation 10 minutes later, he is already snoring. Okay, so can this study 10? A student with prolonged menstruation lasting 13 days. Okay. Abdominal findings as shown in the image. So what we found, based on the abdominal signs, the diagnosis is disorder of the conception vessels, 任脉 problem. So the treatment, first needling bilateral at 列缺 and 照海, 列缺 and 照海. After insertion, the in-条ring 7, no ring 7, this should be not ring 7, this is the kidney, yeah, kidney 7 or kidney 8 and kidney 8 points was palpated again. Yeah. No, okay. So something wrong. I missed some area. Okay. We see we continue again. And the treatment, first step, we needle the bilateral at 列缺 and 照海 points. After insertion, we check the in-jaw point. We check the in-jaw point, and ring 7 was palpated again to check for tenderness. Right after pressing the point, a popping sound was heard, and the patient herself felt a sensation like the chain of the air bubbles bursting. Following this, the palpable heart nodule disappeared completely, and local stiffness softened. The second, continue treat on the left at 中风 and 尺泽 points, and liver 4 and lung 5. Left side kidney 7 and bilateral 内关 points and 太白 points. 太白 is spleen 3. Other abdominal findings were also relieved. On the second day, another treatment session was performed. That night, the menstruation completely stopped. Okay, only did 2 treatments, so the bleeding stopped. And then the following months, I asked her. She said that month the menstrual cycle was completely normal, lasting only for 4 days. It's become normal. Let's see this case. The people have the, sciatic, left sciatic. This is what we found in the tummy, You see, stomach area, the gallbladder 26 area, and lung reflex area. We still can see, the skin folds, it's very deep. Okay, there, the leg, we can see the sign in the, the sign is pressure pain, and we still can see the skin fold. It's very painful. It's very deep. So the treatment, needling right kidney 8 with 3 needles, right gallbladder 41, and Sanjo 5, and gallbladder 26. After needling, the abdominal findings were, you know, elevated, and tightness in the large thigh muscles also noti- noticeably eased. Okay. The second week's visit, when 1 week later, the patient reported a clear reduction in sciatic nerve pain. Upon examination, the abdominal findings had almost completely disappeared. Therefore, treatment focused only on the right lower limb pain found during the examination. Needling in gallbladder meridians using the, metal water method, and we treated the gallbladder 20 as well. So at the end of the treatment, the patient left his in very high spirits. We can see this is a before treatment. This is after second treatment. We can see the skin folds, yeah, in the tummy nearly totally disappeared. In the, the sign, it's become very shallow as well. Okay. Okay. Now we see the last case. Okay. So this patient feels healthy with no significant discomfort and decided to try acupuncture while accompanying his wife for a medical appointment. However, through the abdominal examination, significant tenderness was found in his body. Okay, we can see, so many area the pain found. Okay, so these findings indicate the potential health issues these people have. Even he denied he had not any health issues, but after findings, we believe she has the potential health issues. If without timely treatment, there is possibly of severe diseases emerging within next 1 or 2 years. So we need to treat people before they felt the pain or uncomfortable for themselves. Okay, last we do the conclusions. Why do I recommend that everyone learn ADA? Through today's shared cases and explanations, the clinical efficacy of ADA is evident to all. Anyone can copy and learn this technique quickly, mastering it. Incorporation of 8 extraordinary meridians will allow your clinical diagnosis and formulation of treatment plans to reach new heights. This technique allows clinically inexperienced students new to clinical TCM practice to make quickly accurate diagnosis with abdominal diagnostic for all patient encounters. Then they can calmly apply the corresponding acupuncture treatment, resulting in good clinical results and feedback, as well as potentially achieving economical benefit. This technique allows also allows experienced TCM practitioners who many years of clinical experience to master the concept of abdominal diagnostic to efficiently and effectively break through clinical bottlenecks, improving the clinical efficacy of acupuncture treatment provided to the patient. Okay, this is all we talk about today. So we give people some time. We can answer your questions. Okay.
Thank you, Professor Wang, for taking your precious time to explain and introduce modern abdominal diagnosis acupuncture for us. Well, if you have any question, please type your question in the chat box. We will answer one by one. So the first question is, Professor Wang, when you say we need to treat the previous problem, do you mean the root cause? If not, could you please bring an example?
Sorry, okay. Which one? Okay. We need to treat the previous problem. Do you mean the root cause?
Yes.
Yes, because all the abdominal signs we found is the root cause for the patient. Okay. Some positive signs we found is linked to the current diseases. Okay, but some is linked to the previous diseases. If we only treat the current diseases and ignore the previous diseases, sometimes we can't have the best result. But if we treat the previous, the positive signs first, it can help us to improve the current disease treatment. Okay. The all root treatment.
Right. I will explain some sharing because I have been applying this method in my clinic for the past 2 years. By resolving abdominal findings, we are able to treat patients' conditions at their root cause. Even for very common pain-related problems, abdominal diagnosis acupuncture can be applied effectively. Most importantly, patients do not experience recurrent episodes after treatments. This is because treatment is directed towards the Zangfu organs. In addition to the 12 primary meridians, treatment also involves the 8 extraordinary meridians, which will be taught in the advanced class this year. All right, the third question is, can we treat eye disease with ADA?
Yes, we can, because the eyes in the TCM principles is linked to the, the liver, with liver connected to the eyes. So most of the eyes problem, if we do the abdominal checkup, we will find in the liver reflex area have some tenderness or pressure pain. So we can use this to guide us to treat the eyes problem. And another, the extraordinary, 8 extraordinary meridians, for example, the 跷脉, still can use to treat the eyes problem.
Yes, the Yin Chao Mai, which will be teaching this year in Kuala Lumpur, our on-site class. So the third question is, can you explain the cooling needle techniques? Just a little bit explanation.
Yes, we can. Because today my video, I don't know why they didn't work. So it's difficult to show everyone. But when you, I can tell you, you can put the needles, and just under the skin, and after that, after you put the needle in your skin, and you just lift up the needle tip, okay, to make skin, have the small bubble, okay. So this technique can make people feel calm and feel cooling. For example,
Yes.
I give you an example for the burning pain in the case study. So we use this technique. We treat a lot of people have the burning pain, have the burning. Some of the hot water burning, and some people use for the acne, and some people use some of the lot of cases. If people feel the burning sensations, we use cooling technique around this area. It works very well. So if you can start turn on the lessons in Malaysia, I promise you will learn this technique. Okay.
Yes. It's also very good for insomnia patients.
Mm.
Yeah. Just now,
Yes.
Professor Wang is
Mm.
explained for the uh, sensation, the hot sensation. When the patient have hot sensation, then we can use this method, cooling needle technique. All right. The next question is, after diagnosis on the abdomen, based on what principle or theories to determine the acupuncture point to use?
So after we do the checkup, okay, we found some positive signs. Okay. So we will give you some points linked to this area to do the treatment. What's the principle to help us to find the points? Some is like the metal water point choose treatment. Some just follow the meridians. Okay, we give you some the effective points, just linked to the reflex, abdominal reflex area. Okay.
Yes. The treatment points are selected based on the identified abdominal findings. So that means that if we find the positive sign on the patient's abdomen, then we will have the corresponding points to treat. So Professor Wang will share the points for us. So the next question is almost the same. When the first step is to look out for abdominal signs, after identifying the abdominal sign, how do we select the acupuncture point to treat? So this also will be teach in our seminar.
After identifying the abdominal sign, how do we select? You don't need think about the points because we always give it to you. What the points we should choose. Because every reflex area always follow one or a group point to help you to reduce or clear the positive signs. Okay. They already
All
give it to
right.
you. You don't need to think about it. Okay.
Yes, this all will be given during our seminar, our workshop. So the next question is the modern ADA the same with HARA diagnosis?
And similar, but our teaching is more, sorry, how to say, it's more Chinese way to teach everything. And we give you all the details. We not only give you how to diagnose, how to treat it, and we give you why, give you the reasons. So after you learn our lessons, you should know everything. And when you go home, you can copy it immediately. Okay.
All right. The next question is how much is the workshop? Okay, we will discuss this later. Is the course available online? Yes. For the foundation course, we already have the 3 days recorded seminar for the foundation course, and you can study online. And we also will discuss this later with all of you. So the next question is how we can treat where the part of the abdomen have myome and feel hard when we palpate. Don't quite understand. Dr. Wajuhi, can you explain more for your question?
Okay, yeah, I understand. So this you need to learn because when in the class we will teach you how to do the correct palpations. Okay, only you can do the correct palpations for the abdominal examination. You can find what's wrong in the body. If you don't know how to do the correct abdominal examinations, palpations, so you won't have the good result to find. So it's why we suggest people to attend the lesson. It's very important. Okay.
Right. Okay. What requirements to join in terms of education background? Yeah, as long as you have studied basic of the Chinese medicine theory and also the acupuncture, basic of the acupuncture, then you can join to learn together with us. How long does course last for? Uh, do you mean the online course? Oh, this is a recorded online course, and you can access it for 6 months. But for the on-site course, is about 3 days. Normally, we have 3 days on-site course. So the next question is, does it mean that if the patient has the positive sign on the kidney, there is standard points to use? No need to think about it.
Yes, we choose the 5 points, and it means the 5 points. Yeah.
I
It
think he
does.
means is the patient has the positive sign on the kidney area in the abdomen. Yes,
Yeah.
there is a standard point to use to treat
Or
the,
standard. Okay. Yes, we
yeah,
use the some of the kidney meridians points. For example, if people have the kidney pain, we can choose the kidneys metal and water treatment. It means we can choose the kidney 7 fluid and kidney 9. It's 9 or kidney 10 Yinggu points to treat the kidney pain. It's all the standard points. Yeah, it's standard points. But some is the special points. So during the lesson, we will teach you. For example, the 微气线 points or some of the 三不气 points and immune points. If the points is special, we will teach you. Don't worry. But most points is standard points. Okay.
yeah. I think what his question is, there's a positive side on the kidney area on the abdomen part, right? Of course, there's a corresponding point to treat. All right. The next question is, so the abdominal palpation is the key. Yes.
Yes.
Our treatment is based on the abdominal palpation. When you find a positive size, there is a corresponding point to treat. And this is very useful and effective. All right. Okay, the last question. Thank you for teaching, doctor. Typically, how long is ADA patient and count from DX and TX and reevaluate on day one, then follow up treatment?
Oh, because different area is different. Okay. And in UK, people always like to do the once a week. But according to my experience, in the first time when the people to in your clinic, the better do twice a week is better. Okay, because after 1 week, people can last maybe 2 or 3 days or much better, and then gradually some problem will come back, but it's still better than before. But if you do twice a week, so you can keep the good result. Okay.
All right, all right. Thank you. The last question is, in summary, does it mean that we need to know the palpation skill? After that, the points to treat will be taught in the workshop. No,
Yeah.
all the palpation skill and the treatment points will treat together in the workshop. So you will also learn the palpation skill from Professor Wang. After you learn the palpation skill, Professor Wang will also teach you the corresponding point to treat the patient's problem. So it's together diagnosis and acupuncture together. That's why we call modern abdominal diagnosis and acupuncture. How much time for an individual treatment? All right. So normally it's around 30 to 45 minutes, like for one treatment. All right. Thank you so much. Our seminar is still going on. Huh? All right. As we know, this year, the abdominal diagnosis acupuncture seminar will be conducted in both English and Chinese in Kuala Lumpur, while the English seminar is from 1st to 3rd May this year. So it's a real opportunity to learn directly from Professor Wang. So we can get the first-hand insight into a proven clinical system and discover how abdominal diagnosis acupuncture can redefine your approach to treatment. We are delighted to have Professor Ying Wang with us and warmly invite you to fully engage in this exceptional learning experience. So we now have a special benefits to share with everyone. So let's invite our director, Mr. Chan, to announce it. Welcome.
Hi, thank you, Dr. Grace. Hello, everyone. My name is Christopher Chan, and I'm super excited to be here with you tonight. First of all, a huge thank you for Professor Ying Wang for delivering such an inspiring and insightful session. Wow, Professor Wang's session was not only engaging, but truly motivating for all of us. Once again, we sincerely thank you. Okay, now let's talk about the abdominal diagnosis acupuncture classes. Now, can you share the screen for me? Okay, all right, I can see that. Okay, so for the foundation, we only conduct playback online recorded class because we have done it last year. So the original price for the foundation is 2,880, but for the early bird price now is only 1,800, and that is only valid until 15th of January. So you can start learning immediately after full payment. And for the advanced class, it's a physical class and will be held in Kuala Lumpur Hotel. So the original price for the advanced class is 5,880. But however, we got the early bird price, which is only 4,880. Again, that's until 15th of January. And also, we have included an unlocked 1 year unlimited playback, which is you can learn anytime, anyway, for up to 1 year. So this is quite worth it. And for those who have never attended the foundation class, you are most welcome to start with our recorded online foundation class. After completing it, you can join the advanced class later. For those who have attended last year's foundation class and would like to refresh your knowledge, you can join again and enjoy a special discounted price. For payment, regarding that early bird price, if you need to pay, you no need to pay for 4,880 upfront. Only a deposit of 1,880 is required to secure your early bird price. So okay. Now let me announce exciting news for tonight. Here is the best part. Yongho TCM Center is giving away of 100 ringgit cash voucher exclusively for webinar attendee tonight. As far as I know, many students have already registered and successfully claimed their 100 ringgit cash voucher since we have launched this course. If you missed out previously, this is your final chance to grab this 100 ringgit voucher. Once we end the Zoom meeting, the voucher will be closed. So don't wait anymore. And then this is a great offer for that. For those who have not yet claimed your 100 ringgit cash voucher, please write down your full name and your WhatsApp number in the chat box right now so that our team can assist you immediately. So don't wait anymore, just write down and chat box if you want to get the 100 ringgit cash voucher. And for those who have already claimed 100 ringgit cash voucher and would like to enjoy more reward, here is a special bonus for you tonight. If you refer a friend who registered for the course before 15th of January this month, you will receive an additional 200 ringgit cash voucher. And your friend will also receive a 100 ringgit cash voucher. This is a very special one night only exclusive gift. So don't wait anymore. Please write down your full name and your WhatsApp number in the chat box right now. And don't miss this chance.
Yeah. Correct.
Okay, I can see that so many people is writing down, so I will get my assistant to come and note it down. And Grace, you want to share anything else?
Right. This recorded course is based on a 3-day on-site clinical training program, which is the foundation course. So it has been carefully organized and edited so that you can follow the complete learning process step by step, even you are watching it online. So no worry about that. Even the demonstration, Professor Wang will share the demonstration also for the foundation course. So for the foundation course, let me briefly introduce the contents. There's 3 days. So the foundations and core techniques for day 1, origins, principles, and clinical advantages of abdominal diagnosis acupuncture, common treatment methods like fire points and metal water points, application of abdominal diagnosis acupuncture in menopausal syndrome, techniques for rapid cooling, heating, and yin-yang balancing, live demonstration, and hands-on practice for day 1. All will be recorded in your foundation course, online course. So day 2, we are teaching the positioning and clinical application. Abdominal diagnosis, positioning, and corresponding treatment for simpler standardized diagnosis, practical training in abdominal palpation techniques, clinical demonstration combining breathing, coordination, and needle manipulation to regulate qi. This will be taught in day 2. And for day 3, for the foundation course, we will teach advanced applications and pain management. So like auxiliary diagnostic techniques for the neck and back, treatment strategies for neck and shoulder pain, low back pain, and BO43 area pain, management of structure imbalances using abdominal diagnosis acupuncture, and also on-site demonstration with clinical problem solving. So all will be recorded properly to show everyone in the foundation online course. So you can learn it step by step and not missing anything. And because of this year, Yongho TCM Center is our Yongho TCM Center 10th anniversary. So we would like to sincerely thank you everyone for your continued support over the years. So for this reason, our 3-day in-person course priced at 4880 includes complimentary access to course replace. As I know that this course includes a replay, which we believe is something many organizations are not able to offer, right? So we truly hope you can appreciate this special opportunity and make the most of it. Because after the course concludes, you will be able to review and revisit the professor teaching through our FB private group. So in addition, we also offer a Chinese ADA seminar. So if you are comfortable learning in Chinese, 如果你要学习汉语班的话，你要报名汉语班的话，非常欢迎你。We warmly invite you to join our modern abdominal diagnosis and the 8 extraordinary meridian course, which will be held from April 28 to April 30. 所以汉语班的学员呢，是在4月28号到30号就会学到复诊的基础加奇经八脉的治疗。所以呢，如果大家有需要报名汉语班的呢，可以在之后再联系我。So please feel free to contact me afterwards, and I will be happy to send you the full course details.
Okay, I can see in the chat box there's so many people writing down a name, and some of them put a phone number. Can you please write down your full name plus your WhatsApp number? So because I can see that some people just put down on a number and don't know, so it's difficult to get reach who are you. So just write down your name, your full name, and your WhatsApp number. Some people just write down name without the WhatsApp number. I cannot get reach to you. So please, can you retap again?
And also, yes, I'm answering the question. Is advanced level also available online? Yeah, I think so. We will do the recording, but need to wait. We done the
the
advanced class now.
That is at the moment is a physical advanced class. So after the class has ended, so probably we will do the advanced level for the online class. Can you please write down your WhatsApp number there so that I can reach out to you, so I tell you how much the price will be if once it's available.
Right. When is the Chinese course? The Chinese course is from April 28 to 30 April. It's also a 3-day course. The date of the seminar for the advanced course will be from 1st to 3rd May. So after we do the Chinese course, then will be the English course. So altogether 6 days in Kuala Lumpur.
Okay,
so,
that's great.
Yeah.
I can see that. Right. You're doing well. Very good. I can see the name and the WhatsApp number. Okay. Anyone?
So,
can you please?
As this year marks the 10th anniversary of our company, so participants attending the on-site course can expect a particularly rewarding learning experience. The course fee also includes hotel lunches and tea break. So the advanced ADA course is open to participants who have already completed the foundation course. So because if you not join the foundation course and you come to join the advanced course, maybe there are many questions in your mind during the on-site course. The professor may not be able to respond within a short period. So we suggest you do the ADA step by step. First, you join the foundation course. You can, after you make the payment, we can straight away add you into the private FB private group, and you can start studying now. Then, in the May 1st to 3rd May, you can come to Kuala Lumpur to join the on-site course. So I will explain briefly introduction to the advanced course. So the advanced course also the 3-day. For the day 1 and day 2, Professor Wang will teach the 8 extraordinary meridians. So for clinical application of the 8 confluence points, indications and diagnostic criteria for using the 8 extraordinary meridians, assessment, truth inquiry, tongue and pulse diagnosis, pathways, functions, and treatment strategies of yin qiao, yang qiao, yin wei, yang wei, ren, du, chong, and tai mai. Abdominal diagnostic correlations and reflections, clinical use of C-clef points, diagnosis and treatment of common related disorders, and of course, live demonstrations and hands-on practice. For the day 3, for the advanced abdominal diagnosis applications, we'll teach abdominal diagnosis for head and facial disorders, including ear conditions, abdominal diagnosis-based treatment strategies for thyroid disorders, gynecological applications like menstrual, menopause, and reproductive disorder will be taught. Also, live clinical diagnosis, treatment planning, and needling demonstration will also conclude in the advanced course. I mean, in May, right? So Professor Wang is one of the few experts. Yeah, just do some sharing. Professor Wang is one of the few experts who explain and applies the 8 extraordinary meridians exceptional well. So hopefully you can join the advanced class on site and you will gain a lot from his teaching. Because very few clinicians are able to apply the 8 extraordinary meridians effectively in clinical practice. And even fewer are able to explain them clearly. So, which means that when you learn the 8 extraordinary meridians, you really can upgrade in your skill, acupuncture skill. Because the 12 meridians are rivers, the 8 extraordinary meridians are lakes. Unblocking the 8 extraordinary meridians enhance the effectiveness of treating the 12 meridians. So hopefully everyone can come to Kuala Lumpur to join us for the advanced class.
I can see there's a chat box that's replying to the Katerina. She wants to verify the English course is from 1st May to 3rd May, Grace?
Yes, correct.
Yeah.
From 1st to 3rd May in Kuala Lumpur.
So
We'll announce the hotel later.
Yeah.
For
Chinese
the Chinese seminar will be held from 28 to 30 April.
So right after that, we will start on the next day on the 1st of May. We'll be studying English class until the 3rd May. Altogether, yes. And it's an advanced class.
May is for foundation or advanced. May is for advanced. May is for advanced course. Yeah, May is for advanced course. While the foundation course, you can learn it online straight away, as we say just now. After you make the payment for the foundation, we can straight away add you in the FB private group. Then you can start learning for the foundation. There's a recorded seminar last year we did in Kuala Lumpur. We recorded everything. No,
Yes.
the course fee does not include the hotel accommodation.
Okay, the foundation and advanced will be 1,800 for
Correct.
1,000
if you register.
Yeah, for the foundation online recorded plus 4,880 is the advanced class. That's right. You're right.
You're right. You save a lot because the original price for the advance is 5,880 and for the foundation is 2,880. Total is 8,760 ringgit. But if you register by this week before 15 January, you can save 2,180, which means that you only pay 6,680. Plus, you type your name in the chat box, you will extra get 100 cash voucher, which means you only pay 6,580 for both.
Yeah.
You are learning the foundation and the advanced together for both.
Correct. That's right. If you bring a friend as well, you'll get addition of 200 ringgit extra.
Yes. If you introduce this course to your friends, you will get another 200 cash.
Okay.
Rebate.
Yeah, let me share our company contact details. Junhao, hey, can you help me to share our company contact? Okay. We will be sharing this company detail on the screen. So please feel free to take screenshot, yeah, so that you can keep it for easy reference. If for any reason our team doesn't manage to contact you regarding your cash voucher, no worry. Just send us a WhatsApp message to this number. Any number will do, and we will be more than happy to assist you and make sure you don't miss out on your cash voucher.
So any more question? Which hotel is the venue? We will give you a very, very good hotel. Don't worry about it. I will provide a nice
Okay,
meals
later.
together.
Soon later. Once on the field.
No, the course fees is only for the course. It's not included with the accommodation, but we will help you to make a reservation in the hotel, because normally our seminar is previously is done in the hotel. So we will help you for the reservation of the hotel.
But
So no worry about that.
yeah, but we also provide the lunch as well during the course.
Sure. We'll send the information again later in the WhatsApp group, or we will share it privately to you. So through this training, you will find that abdominal diagnosis acupuncture has a very broad application. It is not limited to specific conditions. It can also be applied across virtually all disease categories. When you master a technique that delivers results patient can feel, it's become a skill that encourages patients to actively book appointments and recommend use to others. This is exactly what this course offers. So is there any more question?
Okay, any more question? No question. Okay, finally, I want, it's very important here. I must emphasize it again and again. Please don't miss this opportunity tonight, because we're going to end the Zoom meeting soon. Register tonight, claim your 100 ringgit cash voucher, enjoy the early bird price. Remember, you must register before 15 January this month and pay a deposit of 1,880 only to secure your place and in advanced class, and also the price of the early bird price. But after 15th of January, the price will be going back to original price. So I must again that this is a very, very good opportunity to grab this offer. Okay, any more question?
So I can share with everyone, based on my clinical experience, the abdominal diagnosis acupuncture is highly effective in regulating the functional activity of the internal organs, especially effective for chronic conditions and long-term constitutional regulations, very effective in gynecological conditions, suitable for elderly patients, can be applied to acute conditions too. And treatment works through the meridian system, including the Zangfu organs and the 8 extraordinary meridians. So we will learn both abdominal diagnosis and the corresponding acupuncture point together in this workshop. So Professor Wang will teach how to palpate, how to look for the positive signs at our abdomen part. And also we will have the corresponding point to treat. And the point is not a lot, maybe 1 meridian, like for the 8 extraordinary meridians, 1 meridian only we choose 2 points to treat, but it's very effective. It's not many points to choose. What I mean is the 8 extraordinary meridians, like the Chong meridian, the Yin Chao meridians. Yeah, normally we just need to choose 2 points to treat the Yin Chao meridians, or the 8 extraordinary meridians. Yeah, the first thing is know where is the problem. Yeah, so after we learn the advanced class, you will gain the very good result in your clinic treatment, acupuncture treatment. All right. If no more question.
Okay, I think that's no more question anymore, and we're going to end the Zoom meeting in a second. So thank you for all for you joining us tonight. I truly can't wait to see you in the class. Please register as soon as possible.
Yeah, if you have any question, please feel free to look for me. I'm Grace. Yeah, you can always WhatsApp me. Yeah, I will answer you.
Or you can WhatsApp me. I'm Christopher Chan. So I hope to see you soon. Thank you.
Yeah. Yeah.
And goodbye.
对，如果是汉语班的学员，也是欢迎你们联系我报名参加汉语班。如果你想参加汉语班的话呢，是4月28号到30号，那就是包括复诊针灸呢加奇经八脉的治疗。所以呢，在3天里面呢，你就是会学到奇经八脉加复诊针灸，复诊的定位都包括在里面了。所以如果你是想学习汉语班的学员呢，就私下再联系我。你也可以把你的名字打上来，我们一样会给你优惠的价格。All right, this is our FB page. Everyone, this is our FB page, company FB page. Yeah, so it's Yongho TCM Center. So please follow this page as we will share a lot of Professor Wang treatment case or his sharing in this page. Of course, I will also share in our WhatsApp group. So once again, thank you everyone for taking your precious time to attend today's webinar. Thank you so much.
And if don't worry, if anyone missed out tonight, we're going to play back later on the Facebook group. So stay tuned on that. We will let you know once it's ready.
Yeah, we will also upload in the YouTube channel. So once we upload, we will share it in the WhatsApp group.
Okay.
Thank you, Dr. Daisy. Thank you.
Thank you. See you then.
Thank you, Dr. Bana. Thank you, Dr. Sailesh. Thank you, Dr. Lily Ho, Yusran, Sim. Thank you, everyone, for your precious time. We'll see you in May. All right. Thank you, Alfred Deng, Dara Karia, and Katerina, Erwin. Thank you.